All right, let's talk about it. That heart in your throat moment when you're staring at a home pregnancy test, trying to decipher a super faint second line. Is it a yes? Is it a no? Is it just a mistake? It's confusing for sure, but don't worry, we're going to break it all down so you can read that result with total confidence.
So, you've done the thing. You followed the instructions perfectly. You waited what feels like the longest 3 minutes of your entire life, and then you see it. Or you think you see it. It's a line so faint you have to squint and hold it up to the light. It's the ultimate cliffhanger, isn't it?
So, is it real? What's the deal? Well, let's put on our detective hats. We're going to solve this little mystery together, and by the end of this, you'll have all the tools you need to get a clear answer. And our investigation, it starts with a little bit of science.
To crack this case, we have to go inside the test itself, kind of like our own little forensics lab. It turns out, this whole thing really just boils down to one very specific hormone.
And that hormone is called human chorionic gonadotropin, or just HCG. Don't worry about the long name. All you need to know is that this is the pregnancy hormone. It's the signal the test is designed to look for. But here's the really crucial part. In a healthy early pregnancy, your HCG levels are going to double roughly every 48 to 72 hours. That rapid increase is a key clue, so just tuck that little fact away for later.
So how does the test actually find this hormone? It's actually a pretty clever system. Think of it like this. As the urine moves across the strip, if any HGC is in there, it gets grabbed by little antibodies that are carrying around some colored dye. This little package then travels down the strip until it hits the test line, where another set of antibodies are waiting to trap it. This creates a little sandwich that holds the dye in one place, forming a line. The control line? That just catches any leftover dye to prove the test is working. Pretty smart, right?
Okay, so here's the big takeaway from all that science. A faint line almost always means HCG has been detected. That's it. The reason it's faint is simply because the concentration of the hormone is still low, which is totally normal if you're testing super early. It's not a sign of a problem, it's just a sign that you've caught things right at the beginning.
But, every good detective story has a twist, a red herring designed to throw you off. In our case, that imposter is something called an evaporation line. So let's figure out how to spot this false clue. So you've got two possibilities here. On one side, you have our real clue, the faint positive, a true sign of pregnancy. And on the other, the false lead, the evaporation line, which is just a meaningless trick of the light from a dried-out test. Knowing the difference between these two is absolutely everything.
All right, let's look at our suspect lineup. This chart makes it super clear. First, look at color. A true positive, even a faint one, will have some color. Pink, blue, whatever the test dye is. An evaporation line, on the other hand, is totally colorless. It looks more like a gray shadow or a pencil mark. Now look at timing. This is just as important. A real positive line shows up within the recommended time window, usually about 3 to 10 minutes. An evaporation line only appears after that window has closed and the test has started to dry.
So where does this pesky evaporation line even come from? Well, it's not magic. The test strip has a little groove or indent where the result line is supposed to form. As the urine of the test dries up, it can leave a faint residue in that groove, creating what looks like a line. It's just a physical artifact. It has zero medical meaning. It's basically a ghost.
Okay, so we've gone through all the evidence. Let's boil this entire investigation down to two simple golden rules. If you remember these two things, you will get an accurate reading every single time. Golden rule number 1, and this is non-negotiable. The line must have color. A real positive is made of dye. So even if it's the faintest, most delicate whisper of a line, if you can see a hint of pink or blue in there, it counts. If it's gray, colorless, or looks like a shadow, you can dismiss it. That is not a positive result. And golden rule number 2, which is just as important, it must appear on time. The results of that test are only valid within the time frame listed in the instructions. That's usually 3, maybe 5, up to 10 minutes. Any line, no matter how clear it looks, that shows up after that window is closed is an evaporation line. Period. You have to ignore it. Now, to help you follow these rules and get the clearest result you can, here are a few pro tips. First, always check that the test isn't expired. Use your first P of the day. That's when the HCG is most concentrated. And this is the most important one. Set a timer on your phone. When that timer goes off, read the result, and then, and this is key, throw the test away. Don't leave it sitting there tempting you to come back an hour later and drive yourself crazy.
So let's say you did it. You followed the rules. You see a faint line, it's got color, and it appeared right on time. This is really exciting, because it almost certainly means you're pregnant. So, what do you do now?
Let's make a clear plan.
Remember that little clue we talked about at the very beginning? The science of HCG? Well, this is where that puzzle piece clicks right into place. Because that hormone is doubling every 2 to 3 days, your best and smartest next step is actually super simple. Just wait and retest.
Let's call this the 48-hour rule. It works like this. On day 1, you get your faint but colored line. Then you wait 2 days. That's it. In that time, the HCG in your system is going to be skyrocketing. So when you take that second test, that faint little line should now be a much darker, clearer, undeniable positive. Seeing the line get darker like that, what people call line progression, is a fantastic sign.
So, let's recap the game plan. 1. You see a faint colored line within the time limit. Congratulations, you are very likely pregnant. 2. Wait 2 or 3 days, then test again to see that line get darker. 3. A darkening line is a great indicator of a healthy, progressing pregnancy. And 4. Once you see that progression, it's time to call your doctor to make it official and get your prenatal care started.
And there you have it. That faint line doesn't have to be a source of stress and confusion anymore. Now that you understand the science and you have those 2 golden rules, color and timing, you can turn all that uncertainty into clarity. The mystery is officially solved. You're now ready to read that next test with complete and total confidence.